A stroke left 78-year-old Tom Neat partially paralysed and unable to speak. But specialist stroke care in hospital, followed by tailored rehab, mean he's made enormous progress in just 3 months.
We'll go on to your knee bends.
Yeah.
That's all right.
Mr Neat has benefited from NHS Great Yarmouth and Waveney's investment in an early supported discharge team.
Well done, that's loads better.
It's given him physio and occupational therapy at home, which Mr Neat says have been vital.
It's a lot easier because you're in your own environment and you can rest in between, you can sit down, and then you can get up and do what you normally done, which is the main objective, is to get you back into the normal way of doing things.
Do you think you would have made the improvements that you have made without this kind of support at home?
No, definitely not.
Writing is still difficult, but one-to-one help means it's improving all the time. This sort of support in the home is of course crucial, but it isn't the sole focus of efforts to improve stroke care. NHS Great Yarmouth and Waveney has also invested further in hospital care for stroke patients, because evidence shows that those treated in specialist stroke wards get better quicker. In fact, almost £2 million has been invested in stroke services in the area, and a new patient pathway with faster screening has been developed. It takes patients from the ambulance to A&E and onto the dedicated stroke ward within 4 hours. They then spend 90% of their stay on the unit. The James Paget University Hospital also offers a 24/7 thrombolysis service, giving clot-busting drugs at the time of stroke. It's existing technology, but used in an integrated way because of intelligent commissioning.
We've never had an acute treatment for stroke before, and the implications for the patient and for patient care in that are huge.
And it's specifically for strokes caused by clots?
Yeah, not everybody is suitable for thrombolysis. The importance of it is not only can it help those patients we thrombolyse, but by allowing us to focus on the acute stroke patients, it's sharpened up all kinds of other aspects of stroke care.
That focus has also meant investment in extra beds on the dedicated stroke ward. It's particularly important for the population NHS Great Yarmouth and Waveney serves, as high levels of deprivation mean cardiovascular disease is a significant cause of illness in the area. Clinicians have been at the forefront of decision-making on investment.
I think it's really in some ways impossible to commission well without involving clinicians. It's vital not only that they're involved in the design phase, but actually that they have ownership of the transformed service and that they are able to lead and champion the transformation. And it's vital that on the ground there are clinical leaders who understand the direction of travel, who know what good looks like and what we're driving towards, and who are able to maintain that focus consistently.
Evie Cooper manages the team of physios and occupational therapists who work with patients in hospital. She also leads the early supported discharge team, which helps at least 2 patients each week return home sooner.
The advantages of being able to work out in the patient's home where they're comfortable with their family carers if they want is much greater. So the goals we've been able to tackle have really been much more individualised and hopefully really mean something to the patient. And equally, they're very rewarding for the staff as well.
Tom Neat's goals are now to walk without his stick and to get back to the gym. He has nothing but praise for the hospital care and home rehab he's received. His hope is that even more patients will now benefit from the specialist support that's aided his remarkable recovery from stroke.